Whenever you have surgery, regardless of whether it's with a plastic surgeon, a general surgeon, any type of surgery that involves making incisions on the skin, you're going to have a scar. So that's important to know. Now, the key is to try to minimize the appearance of scars. So there's a couple of things that I want to talk about. So some of that is the plastic surgeon's job, but then the patients also have a job as well. So what does a plastic surgeon do to try to minimize scarring? So number one, we plan out our surgery ahead of time, so we know exactly where and what type and how large or small of an incision we need to make. We try to keep that incision as small as possible while still making it sizable enough to safely perform your surgery. The next thing that we do is we plan our surgical incision in areas or spaces on your body where we can minimize the appearance of the scar. Now that may be in a natural skin crease or in a natural fold, in a pre-existing scar, in natural wrinkle lines, things like that. So we minimize the appearance of the scar. We also orient the scar in a particular orientation where it lines up with the natural creases or folds in the skin. And then another important job is when we're actually closing the incision, we're especially trained through extra years of residency on how to sew to make sure that the scars heal excellently. The final thing is we counsel patients on how to take care of their scars, which comes to point number two. What is your job after having surgery to take care of your scar? So scars take 6 to 12 months to mature. So what does this mean? So mature means for the scar to soften and fade. So when we have a scar and we're healing from surgery, our body is making collagen. That's what makes up the scar. Initially, at the beginning of scar formation, the scar will be oftentimes pink. It may be a little thick. There may be some tissue in the skin as well as tissue under the skin that feels thick. You'll have swelling in place. You'll have a little bit of inflammation and healing factors that are causing a scar to be apparent. Over that 6 to 12 month, up to that 6 to 12 month time frame, your body is doing its job to soften the scar, to let swelling resolve, and for the pink or red discoloration to go away. In the end, we should end up with a nice, thin, linear scar that's pale, close to your own skin color, soft, feels like normal skin. It's not thickened or raised.